Today I'm going to be talking about guanfacine and ADHD. Again, I'll be talking for 20 minutes. If you have questions during the time, you can type them in and I will hopefully be able to find them and answer them at the end of the session. So guanfacine is a non-stimulant medication. It's not Adderall or amphetamine. It's not methylphenidate or Ritalin. It's what's called an alpha agonist, or more specifically, it's an agonist at the alpha-2A receptor system, and the adrenergic refers to adrenaline, which is the neurotransmitter involved here. Adrenaline is just another name for epinephrine, so those two are the same things. You're familiar with them in terms of the surge you get when you're in an excited, tense situation, the adrenaline surge. So this is the neurotransmitter receptor this system works on. And the effect of having an alpha adrenergic agent, agonist, is to release norepinephrine, and that norepinephrine release goes back and feeds back and damps down the sympathetic nervous system. And given that the blood pressure, blood vessels, the arteries throughout your body have strong sympathetic innervation, decreasing that sympathetic nervous system tone allows blood vessels to relax. And that's how this medicine, guanfacine, works for lowering blood pressure. It was approved for blood pressure in 1986. And what does that have to do with ADHD? Wouldn't you think that actually something that makes you more relaxed would be counterintuitively helpful for ADHD? So drugs and neurotransmitters aren't evenly distributed throughout the brain, and there's a concentration of alpha adrenergic receptors in the prefrontal cortex. And the action of guanfacine there is to actually, so stimulating the adrenoreceptors in the frontal cortex leads to a decrease in cyclic AMP channels openings. And the downside effect of that is that there's greater coordination of connectivity in the frontal cortex. There's greater coordination of neurons firing together, so both structural and physiologic, greater coordination. And that activation in systems in the prefrontal cortex actually goes and feeds back to the locus ceruleus, which is the place where most of the noradrenergic cells in your body. So again, this is the noradrenergic, now norepinephrine cells in the body have their cell bodies, and it changes how the locus ceruleus fires so that it's firing at more relevant stimuli and less frequently firing at irrelevant stimuli. So labs primarily at Yale University started investigating guanfacine and Clonidine, a similarly acting drug, in the late 80s, 90s, and watching its benefits for ADHD. And in the year 2010, the FDA did approve a long-acting form of guanfacine under the brand name Intuniv for children from the age of 6 to 17, or specifically for ADHD. And they did it because studies had come out, both early studies on the immediate release form of guanfacine and then studies specifically on the product known as Intuniv, the slow release form, which showed measurable improvement in a broad range of ADHD symptoms. So there was improvement in hyperactivity, impulsivity, sleep disturbance, emotional overreactivity that are found in ADHD. And when I was getting ready for this event and searching different studies that have looked at guanfacine, there's a whole host of ADHD symptoms. Now, not every study looked at all these variables, but guanfacine has been shown to improve inattentiveness. It's shown to boost productivity. It's been shown to help with the initiation of tasks. It's been shown to help with planning and organization. It's been shown to help improve self-monitoring during tasks, which we know is one of the areas that leads to lots of problems with people interrupting tasks with ADD, getting distracted, not knowing where they are in the midst of things. Measurable improvements have been found on quality of life measures for people on guanfacine, improvement in relationships. And so it seems to help a broad range of ADHD symptoms. Now, unlike the stimulants, which tend to work within minutes or hours robustly, and almost all of their action is upfront, immediate, and robust, these effects seem to be somewhat more gradual with guanfacine, although studies looking at just a starting point and then a 2-week follow-up show measurable, robust improvement, and again, a host of hyperactivity, impulsivity variables. And there have been studies that have gone out as far as a year, looking every few weeks, and there is sustained benefit from those who are obtaining benefit for ADHD symptoms out well longer than a year. So a couple things. So when Intuniv was approved, it was approved as a standalone agent for ADHD. In terms of the size of the benefits, most of the studies suggest it's not quite as robust an effect as we get with Adderall. But there's at least one in adults which did a direct comparison, and again at the 2-week point showed benefits on the scales they used that were as robust as the stimulant group. Again, the overall consensus in the field is that these are not usually the first medications to go to because the effect is not usually as robust. But it may help, again, with the broader range of agents or symptoms of ADHD. And more importantly than just being approved as a standalone agent, when the FDA approved this, it is guanfacine Intuniv is also approved specifically in coordination or conjunction with a stimulant medication. So in the real world life, most of Intuniv guanfacine seems to be being prescribed with a stimulant. Very clearly, it helps many people tolerate stimulants better. So particularly that feeling too aroused, too revved up, which often can be addressed by decreasing the dose, but in some really sensitive people not. This helps make stimulants be more tolerable. Some people, so this can be added on top of stimulants to make them more tolerable. Some people sort of go back to the beginning and then start someone or restart first on guanfacine, and when they're stable, gradually try to reintroduce stimulants. And there's good studies showing that adults and children who could not tolerate stimulants at all before can tolerate them after they have adjusted and first been taking guanfacine. And again, particularly areas of emotional volatility, overreactivity, sleep disturbances, some of the hyperactivity that seem to be particularly targets of benefit for guanfacine use. So that's the good part of the story. So what's the down part of the story? So as with any medication, there are some side effects. The commonest one seems to be sleepiness and sedation. That does again seem a paradoxical effect in people with ADHD, or the medicine that's not in people that's effective for ADHD. Most of the studies show that sleepiness or sedation people do become accustomed to, or the symptom actually decreases within the first 2 weeks. So that does not tend to be an ongoing problem. Again, although this drug for some people has a special role in terms of helping with sleep, people with sleep disturbances and ADHD. Other common side effects are nausea and headaches. Those are about in the 10% range. And again, those also seem to adjust with time. There's a host of less common side effects, including dry mouth, decreased appetite. Some people actually have an increase in irritability. Some people, depression and anxiety have been reported. Those are approximately at the 1% of people range, but given that more commonly people get relief from anxiety and help with it, that's something to be alerted to and aware of as a prescribing or a doctor or as a patient taking these. Other side effects includes lowering the tolerance for alcohol. So this really is one of the drugs you probably should not be drinking alcohol when you're on it. People whose blood pressure is normal to begin with, so just as our antidepressants don't boost everyone's mood up 3 notches, they get rid of a pathological state of depression when it's there most of the time. Similarly, Most of the classes of our antihypertensives or blood pressure lowering agents don't just lower blood pressure in everyone. What they do is intercede in pathological processes in people who have hypertension, bring them down to a lower level. So it's not that everyone with guanfacine has their blood pressure lowered. Some people do, and that's a risk to look out for. It's the most problematic area, and this has been only about 1% of people on guanfacine, and it's common with some of our other drugs, is what's called orthostatic hypotension, where with a change in posture, standing up when you've been sitting for a while or getting out of bed in the morning, your blood pressure drops. Or actually, it's not your blood pressure drops, your blood pressure fails to quickly increase, which is what we normally do when we change posture. It's actually a pretty complex plumbing and pressure situation that the brain usually figures out perfectly. Again, sometimes with orthostatic hypotension, someone changes posture, blood pressure is still too low, and they faint or pass out or hit their head. Again, it's uncommon, but something to be aware of. And of a little more concern among the cardiologists is that clonidine, which is a close cousin alpha agonist agent, similar but different in some ways from guanfacine, clonidine is notorious for what's called withdrawal hypertension. So someone who's been on it for controlling their blood pressure, and clonidine has also been studied with positive effects in ADHD. But many times, if someone misses a single day of their clonidine, so this is not Clonopin, completely different medication, missing clonidine for even a day can lead to a withdrawal, huge boost in hypertension and way above what it was initially. So it can boost it to dangerous levels, up to 200 points systolically. That is possible with guanfacine. The rates in the studies where they explicitly looked at it, and they had to do studies, because people with ADHD often forget medications. So they looked, they studied it before Intuniv was released. Rebound hypertension or withdrawal hypertension seems extremely uncommon in the 1% to 2% range of people who are on guanfacine. And part of it may be just that guanfacine's half-life or its elimination life is longer than clonidine. Your body isn't flushing it out as rapidly, so you're not undergoing as extreme withdrawal. So again, advantages of guanfacine: it is not a stimulant, it's not a controlled substance, no potential has been found for addiction, it's not going to cause amphetamine-induced psychosis. It's not likely to make someone more and more anxious and agitated as you go higher on the dose. And one other advantage, and this is comparing it more to Strattera, Wellbutrin, duloxetine. Strattera, which is FDA approved, atomoxetine for ADHD, and Wellbutrin and duloxetine, which each have dozens of studies off-labeling using them for ADHD. All those antidepressant-like agents have a warning for an increased risk of suicidality. It doesn't seem to be a big risk, but given that's such a serious potential side effect, again, that does not seem to be a risk present with guanfacine. So other sort of simple facts or information. So the generic guanfacine, when I went on goodrx.com, and if you're not familiar with that, so GOODRX.com. If you put in your medications, if you put in your zip code, you can find, I'm not getting paid for them, this public service announcement. They will tell you the price at different local pharmacies for your medication. Often if you have insurance, the out-of-pocket costs are irrelevant, but a milligram a day, so a 30-day supply of 1 milligram of immediate release guanfacine is about $10 at different stores. For the extended release generic brand, so the generic version of Intuniv, it was anywhere from $20 to $80 for a month's worth, but the brand name Intuniv was over $300, again, at various pharmacies, so there's a big difference between them. Again, there were numerous studies before Intuniv was developed showing that immediate release guanfacine was effective. To my knowledge, I could not find any direct head-to-head studies comparing immediate release to extended release. One of the advantages of the extended release is that by stretching out the release of the medication, you're never peaking at as high a level, and that does seem to help lessen side effects. My strategy is usually to prescribe the guanfacine all at bedtime, and particularly any sedating effects are then enhanced during sleep. And I've certainly seen people obtain daytime benefit from it. And again, given that it's not clear, with the stimulants, it's quite clear that the benefits are entirely related to the amount of drug in your blood at the time or the change in the amount of drug in your blood at your time. But there's a very close correlation to what's in your blood and what kind of response you're getting. Whereas looking at our antidepressant medications, there's actually a very poor correlation in the day-to-day sense or hour-to-hour sense in terms of benefits and how much drug is in your system, because the benefits are indirect effects through a cascade of neurons interacting. So again, most of the time I dose guanfacine entirely at the end of the day, at the nighttime. Whether I am losing some benefit in patients by doing some, that may be so, and whether there's clear benefits or advantages of the extended release over the immediate release is also less clear. And again, this is something that can be used alone for treating ADHD. It can be used with a stimulant to both potentiate the good effects and to minimize some of the potentially over-arousing effects. And maybe more than our stimulants or other medications, it may be particularly good for some of the emotional overreactivity, volatility. But again, it's clearly helpful for a broad range of inattentive and hyperactive impulsive symptoms. That's about all I have to say for now. I will look to see if there are any questions or comments. I haven't seen any, but again, I'm on my laptop right now, not my mainframe, not my desktop. I don't have a mainframe computer. Next week's topic is going to be not central to ADHD, more a brain neuroscience issue, and that's on the brain's sort of trash removal system, which is active during sleep and has only been sort of discovered and researched in the last decade. So that will be next week's topic. So I am going to end the, see, I'm not seeing any comments coming in, so I will end the video now. If you have comments later, you can certainly type them in, and I'm sorry if my technical glitches prevented anyone from seeing this. I do believe it should still be stored and available at the site later. So have a good and safe week. That's all. Bye.